So your question is kind of what's your risk as a physician? And so that gets us to this bottom hot topic. What's the kind of liability you incur? Let me say at the outset, I'm not a products liability attorney. I do FDA related enforcement and regulatory work. I want to be clear that my thoughts and advice to you on this should not carry the day. But I have talked to folks who practice in this area who I think generally are of the mind that if a doctor is writing a prescription that's kind of consistent with the standard of care and has no reason to believe that the compounded drug is going to be in any way infirm or problematic, then it would seem that the risks are probably not high. If there is reason to believe, because you know as a physician that the pharmacy with whom you've been doing business has had all sorts of regulatory issues, they have consistently failed to ensure that their products are sterile, and you're aware of this, and you could be accused of engaging in some sort of willful blindness, then I think that there's potentially a concern that somebody might seek redress against you. One issue, of course, is whether or not you are or are not liable. When people get hurt, they tend to be upset, and they tend to basically sue people who are involved in that. And so something that's useful to think about is trying to avoid people getting hurt in the first place. So if you are dealing with a pharmacy that has a history of producing drugs that are injuring people, you ought, I think, to pay attention to that, because I think that if folks under the guise of your care are getting injured, whether it's directly you're doing or not, they're more likely to be, I think, upset, litigious, etc. And you may or may not be more likely to be kind of swept up in something like that. So.